In India, bodies of COVID-19 victims are piling up so fast that family members have to cremate them in parking lots. In Brazil, gravediggers work through the night. And in Germany, once a poster child for its pandemic response, the death toll has tripled in recent months and the federal government has just imposed its toughest lockdown yet. Even as optimism abounds in the United States, where cases are in steep decline and the vaccine supply has begun to exceed the demand, the COVID-19 pandemic has reached one of its bleakest points as global vaccination campaigns sputter and new, faster-spreading variants take hold. A record 5.7 million new cases were reported worldwide over the last week, nearly double the 7-day average in late February. The death toll, now approaching 3.1 million, grew by more than 87,000. Those figures have increased pressure on the United States, which along with other wealthy countries has gobbled up most of the supply, to speed up vaccine production and distribution around the world. The global surge has also raised fears that the worst of the pandemic may still be yet to come. Only 2 months ago, India appeared to have a handle on COVID-19. Cities began allowing people to gather again for weddings, cricket matches and religious festivals, including Kumbh Mela, when millions of pilgrims descend on the sacred Ganges and Yamuna rivers. The relaxing of restrictions proved disastrously premature as the number of cases exploded, buckling a healthcare system that fails to serve the nation's needs even during normal times. Over the last week, nearly half the world's infections and 15% of its deaths were in India, where people waiting for medical attention were dying outside hospitals, forcing families, including that of 35-year-old homemaker Faiza Khan, to make wrenching choices. Just a few days after Khan gave birth to a healthy baby girl in New Delhi, she started feeling short of breath. Her family searched frantically for medical care, but hospitals were deluged and oxygen tanks were selling for $660 on the black market, $260 more than what Khan's husband earns in a month. The family pooled resources to buy a tank, and then made a desperate decision. They were planning to travel nearly 700 miles to a private hospital where a friend works in hopes that Khan would be able to receive treatment there. "I've never seen a humanitarian crisis of this proportion in India," said Ramanan Laxminarayan, director of the Center for Disease Dynamics, Economics and Policy, who is in Mumbai. "It's just horrible. There was a sense from the government that COVID had been dealt with," he said. "But the nature of the virus is that it loves people in close proximity. Mutations are also driving the surge of infections in India and elsewhere. Research into a new variant known as B.1.